The value to me has been to drink from a fire hose of knowledge, of experienced people who've done this before, who've studied this aspect of work. It would take us more than a year or two to replace what we've learned in just 3 months here. Breadth of expertise that's brought to bear in our training and preparation here, the wisdom and previous experience of the advisors who work here for the Innovation Institute, it's a once-in-a-lifetime opportunity.
Hi, my name is Caroline Negley with Otricath, and we provide an alternative to systemic chemotherapy for patients with solid tumors with initial indication in liver cancer. Everyone knows the harsh reality of cancer. It's the whole reason why this device was invented. Our founder, Dr. Calderon, witnessed patients refusing further chemo treatments because of the devastating side effects they were experiencing. This hits even closer to home for us right now as a team, as our president, John Izzard, who you just saw, had 2 family members recently diagnosed with end-stage brain and kidney cancer, and so he can't be with us today. But John's story isn't the only one. More than 650,000 patients receive chemotherapy every year. More than 40% of these patients will experience adverse side effects to systemic chemotherapy. These effects impact not only their quality of life, but also their ability to tolerate further treatments. This is especially true for liver cancer, which is a market of a significant unmet need and with limited treatment options. One of the worst things for chemotherapy is that it is untargeted, which is analogous to carpet bombing an entire city just to hit one building. Instead, Otricath acts more like a targeted missile. Under image guidance, an interventional radiologist can guide a catheter through the body directly to a tumor in the liver. Our device is a 3-part catheter. 1 catheter infuses, 1 catheter withdraws, and the middle catheter monitors pressure. Our technology allows for a physician to directly target a tumor with a high concentration of anti-cancer agent, saturate the tumor for as long as they deem necessary, and withdraw anything not absorbed by the tumor cells, thereby preventing the toxic drug from traveling throughout the body. While targeted chemotherapy is not a new concept and other catheter-based treatments have recognized this unmet need, their arterial approach versus our venous approach fails to significantly prevent systemic leakage. Other competitive advantages for Otricath are that we are drug agnostic and that we can sample the tumor site during the procedure and analyze in real time. We see this technology as a platform technology that can be used to treat solid tumors and other organs. With more than 530,000 incidences of solid tumors in the US annually at an average treatment cost of $20,000 per patient, this translates to a total available market of $11 billion. But our initial entry would be with liver cancer, with more than 39,000 cases in 2015. At an average cost of $20,000 per patient, this allows for an initial market potential of $800 million. We've established key collaborations in the Texas Medical Center. With the help of Dr. Billy Cohn and Dr. Barry Toombs, we've established our proof of concept in vivo pig studies at Texas Heart Institute. Our upcoming studies will be in pigs with liver cancer with the help of Dr. Stephen Curley and his team over there, who is chief surgical oncologist at Baylor College of Medicine, And Texas Children's Hospital is interested in developing a pediatric model of our device for use in children with liver cancer. We have 2 issued patents, one on the catheter system and one on the computerized monitoring system. We have done in vivo proof of concept studies, and we have a working prototype. We are hoping to finish our seed round of $400,000 in early 2017, which will allow us to refine our prototype, continue our preclinical studies, and initiate discussion with the FDA. Further series funding will allow us to conduct our GLP studies, finish our prototype, finalize our prototype, and achieve 510(k) regulatory clearance. Excuse me. So we are looking for investors to help us to complete our seed round. We are also looking to expand our executive leadership team, specifically someone who has experience in taking a medical device to market. We have some prototypes we have a mouse and pig prototype over at our table, so please come by and chat with us after the show. Thank you so much.